money no object, time is not an issue. What can I do without surgery to just like optimize myself from head to toe? This is what we would recommend. And
But what that means is you actually have to get more frequent treatments.
no, again, that's not, if you have sagging bands of loose skin, that's not going to be the solution.
It will help hair growth about 30%. So if you have thinning hair, yes, you're going to have more hair. If you're totally bald, it helps, but it doesn't help that much. So
Welcome to the Beauty Scientists with Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
Hello, this is Dr. Roy Kim, part of the Beauty Scientists, along with my partner, Dr. Kristy Hamilton.
Hey, how are you
How
doing?
are you? I'm good. How are you?
Great. So excited. I'm really excited about this topic. I think it's fun.
Yes. So the topic we're going to talk about are the most expensive aesthetic procedures, sort of more maintenance, less surgical procedures that you can get. So there are a couple caveats. One is these are expensive. We don't think that anybody's getting all of them all at once. But hey, if you're out there, we'd love to see you. And the second thing is it's not just about money. It's about time for recovery. If you have things to do, I don't think it's easy to get all of these procedures all at once. But hey, if you are one of those people who wants it all and is in Houston or San Francisco or Los Angeles, please give us a call.
Yeah. So this is like the ideal. Like if you had a patient coming in where they're like, money no object, time is not an issue. What can I do without surgery to just like optimize myself from head to toe? This is what we would recommend. And I'm going to try to do as much of this as possible after I birthed this baby. So I was like, a lot of these are in my imminent future. So pay attention if you're intrigued, because this is real. This is happening very soon.
If you own the candy store, you can eat as much candy as you want.
Some of the benefits of having your own practice, for sure.
That's right. So first thing first is skin. So we talked about this just right before we went on air. Glass skin facials. So a little more expensive. What do you think about them, and how often would you get them ideally if money was no object?
I think doing them quarterly is great. This is also one of the treatments that really doesn't have any downtime or of substance. And so that's nice. You can come in, you can infuse your skin with all this goodness, growth factors from the PRP, pigment correctors, Botox, injection grade hyaluronic acid. So this is just like you're getting that beautiful glow, and you walk out of the office with it, and it just gets better and better over the next couple of days. Minimal downtime. It's great for brides, special events. So that incorporating that into your routine quarterly, I think it's just a beautiful way just to have radiant skin. What do you think?
I totally agree. And it is more on the pricey side, because the minimum is that you're mixing neurotoxin and HA filler. You want to throw in growth factors. The recovery is quick, but yes, if you're talking about getting a quarterly every 4 months, it does add up over time, but it is a great way to have your skin glowing with minimal makeup year round.
Yes. And we think about, it's like hydration. It's like a glass of water for your skin, except everything's actually going into your skin itself. So all those things in our serums that we're hoping get into the skin. And then so many of the fan favorites, like the HA fillers and the Botox, just like all in one, and the blood draw for the PRP. So you're right. It is a combination of some of the more expensive maintenance treatments altogether. What else would you do for your skin?
Laser treatment of some kind. So laser treatments in general can be fairly big. You have to hide from people for a week or two, longer recovery. You can definitely get specific lasers based on your ethnicity, based on your needs, sort of crank it down so you're not getting a maximum blast. But what that means is you actually have to get more frequent treatments.
Yes. So you can go for, like, assuming your skin can handle it, you can go for one really big gun treatment a year with the downtime. That's what I'm going to do next month. Normally, what I do is the intensive fractionated CO2 laser, but I'll do lighter settings and do it more frequently during the year so that I don't have to take as much time off. Because I feel, in our profession, I think our patients, it's going to be kind of expected if we show up looking a little funny. Like when recovering from something, like that's maybe not such a surprise, but if you do the really intensive one, you are going to need some days off for sure.
And how often would you do the less intensive one?
The less intensive one, I actually will do quarterly. But if you're one of my patients and we're talking about the more intensive treatments, like deep laser treatment, we'll suggest annually. And that's beautiful. We do it in the winter, so less sun exposure, more downtime. January is a great month after all the holidays.
Yeah. So speaking of your skin and your face, next up is hair. So everybody knows men tend to lose their hair. What's interesting is that, of course, women tend to lose their hair. The ponytail that you had when you were a teenager, it's going to be a little thinner as you become an adult. And men definitely have male pattern baldness, but women also can have patches or areas where it's a little thinner. One great way to treat it is PRP or PRMF or a combination of both. How often would you recommend getting it if, cost wasn't an issue and you could just live at your plastic surgeon's office?
A little controversial. I don't think there's a true answer to this question, but I know a lot of us do at least a round of 3 monthly, and then we'll spread it out quarterly thereafter. By your 3rd treatment, a month after that, you should be seeing some difference in your hair. And so if you are, that's a great signal to continue. I've also enjoyed adding, there's a new addition to my practice, so we'll see how it goes, but there's been some excitement about exosome therapy too for the scalp. So I've started to microneedle that into the scalp itself. And I know some of our mutual plastic surgeon friends are singing its praises, so it's too early for me to comment on the results of that, but I think that could be a nice combination therapy with the PRP injections too.
And then for our listeners or viewers, PRP is platelet-rich plasma. So what we do is we withdraw the blood, put it in tubes, spin it or centrifuge it, and after a certain period of time, correct type of test tube, we're going to get some yellowish or pure yellow liquid at the top. That's the stuff that we want to inject where you're balding, where you have less hair, because that will actually stimulate your hair stem cells, the follicles, and help it grow. The other thing is, the studies I've read is that it will help hair growth about 30%. So if you have thinning hair, yes, you're going to have more hair. If you're totally bald, it helps, but it doesn't help that much. So our thinking is, hey, let's start monthly or every 2-month PRP injections when you're 20 or 25, which sounds ridiculous, but that's actually when your hair starts to thin.
And you want to get ahead of it, of course, before, so that you don't want to wait until you have noticeable hair loss. You would like to get ahead of it before. But let's say you're just, you're just listening to our podcast, you're just finding out about this, you already have significant areas like where it is bald. What would you suggest then?
Ideally, you would get FUE or micro hair transplants or single hair follicle grafts. So in other words, you take out one hair and you put it in the area that's bald with one tiny hole. So there's, without getting too much into the weeds and talking too much, you need to have hair. You need to have better quality hair. So thinner hair doesn't work as well as thicker hair. The other thing is that the recipient site, you actually can't put in too many hairs. Typically, from what I've read and from what I've done, it's about 3,000, maybe 4,000 single hair follicles, which is a lot. It's just that when you look at the surface area, sadly, in some patients, it's not that much. You may need 2 or 3 rounds to get total coverage of your scalp.
And you're really just moving those hairs around. Like you're not growing new ones. So there's an absolute number. We're taking it from a denser area and moving it. So we still want to support those, which is why I also think even after having the hair transplants of whatever kind, it's nice to maintain that result, complement it with the PRP injections. And so we have a number of patients that do that too. Of course, combining it with the vitamins and on the serums and the shampoos and all of that, because hair is really like you have to attack it from all angles.
Yes. I mean, blood flow / nutrients, as well as surface at the scalp, as well as, hair transplants are a procedure. I don't know if it's full-blown surgery, but it's still a procedure to remove that many single hair, follicles and then place them back.
Yes, absolutely.
Yeah. So what are your thoughts on Botox and fillers, assuming that money's no object and you could actually get it on a very consistent basis?
So I Botox myself every 3 months. This is the longest I've not been Botox because I'm pregnant. I started when I was 27. And so actually what's been so great is like now, as you can see, for example, I've got full movement, but since I've been doing it consistently since I was 27, even though it's been 9 months since I've had anything, I can make all these expressions and I can even make some lines, but when I stop moving my face, they haven't come back yet. So that really speaks to the power, the preventative element of Botox and neuromodulator treatment too. So, but I'm ready to get my brow lift back and, slim my masseters. It's going to be great. So I'm all in on judicious and regular use of Botox, and then filler. I think filler is a great product. I love the hyaluronic ones for the face because I think it's always important to know you can dissolve them if need be, just as time goes on. And I think you have a similar philosophy as me, Dr. Kim, with this, but I think little sprinkles, optimizations of the face, micro adjustments, that is what keeps filler looking so beautiful, really enhancing your own structure. So I'm more liberal with the neuromodulator like Botox and much more conservative with the filler, and really like to do that. I think on average, I'm refreshing areas every 2 years or so. But what I'll do is I'll kind of just tweak little things here and there on my face as time goes on. And I think that's what keeps things looking natural.
I love if I can give literally one syringe of filler, maybe once a year, or maybe 2 syringes once a year, and place it everywhere. So you might need some in your lips, your cheek, your nasolabial fold, the jowl line, your angle of the mandible, but not go crazy, but you're always maintaining it.
Yeah. Once you've created, like, sometimes we'll do like a little bit, especially if someone comes in, they've never done it. We might have a plan for a couple of syringes over that first year, or even do it all in one session. But then after that, the goal is to just like conservatively replenish, not kind of inject full syringes every 3 months.
Like I totally
Botox.
agree. Yeah.
Yeah.
And then one other thing, which is, I think, maybe not expensive, but one thing that younger patients should consider, or at least this is what some people do, is eyelid lift. So in other words, you may need literally, 1 or 2 millimeters of skin removed in your 30s or 40s, like not much of an eyelid lift, not much skin removed. And it sounds a bit nuts to some people where, hey, you're going to need an eyelid lift every 10 years-ish, but you're removing an unbelievably tiny strip of skin. But recovery's faster, nobody notices, but you are committing to a much smaller procedure, possibly 2 or 3 times in your life.
Yeah, and then again, people aren't going to notice. It's not this like you went from having all this eyelid skin to like clearly something, even if the result's natural, you're just going to look different to the people who know you.
Yeah.
People who don't know you will just be like, oh, like he or she looks great. But I think, once you become an appropriate surgical candidate, it is nice, especially with the face, to intervene on the earlier side so that the changes are more subtle and it is easier to recover.
Yeah. So what would you do for the neck, and especially the horizontal necklines here? Tech neck.
The tech neck. Everyone's all about getting rid of the tech neck. So I like a combination of Botox. So for the vertical lines, I also think it helps with the horizontal lines too, kind of relaxing that neck muscle called the platysma back, helps create more definition. And then I like hyperdilute biostimulators like Radius or Sculptra even there. And then for deep lines, we'll actually directly inject hyaluronic acid into them too to plump those up. Now, again, that's not, if you have sagging bands of loose skin, that's not going to be the solution. But when you have like relatively taut skin and you're starting to get those creases, that works really, really nicely. And I think the neck is another area where prevention is key. So if you have the ability to start working on these areas now, you're already coming in for your upper third Botox, neck, lower face is a great place to start incorporating that in, and then a little bit of filler here and there.
Yeah. And another option, although it's a procedure, is actually fat grafting. So we can extract fat from you and place it in those horizontal lines and, even use it that fill in your face. But that's a procedure. That's not something that we can easily crack open a box and actually give it to you easily in an office setting.
But it's minimally invasive, and to your point, it's really just like little needle entrance sites. So there's almost no evidence of it having ever happened. And if you're considering like your hands, your face, your neck, all of that, then it actually may even become cost effective at that point over multiple products being pulled off the shelf.
Yeah. So for the hands and feet, we do recommend, if possible, giving HA filler, Radiesse, fat grafting, some type of filler that's regenerative or hyaluronic acid to the hands and feet to keep you looking young. Because since we walk and since we use our hands a lot, it will fade, especially if it's not fat.
Yeah. And what we see is like, we see a lot of patients taking great care of their face, maybe less care of their neck, less care of their décolletage, less care of their hands. And all of a sudden you start to notice those because they look discordant with the face. And what we notice in the back of the hands is we start to see more of the tendons, more of the veins. They start to look a little bit more skeletal. And we know volume in these areas is desirable. So if you can do something nice to plump them and then also do something for the skin itself.
Yes.
So, because we'll see sunspots and aging and wrinkles on that too. So the combination of adding some volume, whether it's be it with fat or a filler, and then, you know, there's chemical peels for hands, and I will do laser resurfacing on hands where appropriate as well.
Yeah. And then next up, one of the newer technologies, and one that I don't think anybody really does this, but we definitely would love to, something that would be something RF microneedling to the entire body. In other words, you're giving low-grade tightness or heat to all of the skin of your body. And that would also imply, since it's a little painful, you'd probably have to be under some type of sedation anesthesia to actually get it over your entire body on a consistent basis.
Yeah. And so we see people doing that, like they may be having liposuction, and then they'll also get like their whole body RF microneedle because it is painful, to your point, and it does take a long time.
Yes.
So that's also something to consider. It's, you know, you can certainly move faster under general anesthesia than you can awake, but you know, we don't like to keep people under anesthesia for overly long periods of time either. So we know heating the tissue to a certain degree stimulates collagen. And so I think that's ultimately one of the dreams, right? That we kind of just walk into some sort of chamber and just get zapped with heat and then walk out and everything's kind of cinched itself up. That technology doesn't quite exist yet, but I'm waiting for that. I think that sounds great because we're doing all this stuff for our face can really handle so much heat because of the oil, the sebaceous glands, the oil glands. The body you have to be more careful with. It's easier to cause hyperpigmentation and just slower to heal than the face, for sure.
Yeah. And then finally, we have a lot of non-surgical or possibly surgical options to help with your body contouring. So first up would be injection of some agent that is easy to get, that's not fat. So, of course, many of us do have extra fat. We do think that fat harvesting and fat grafting is fantastic, but we can actually inject Sculptra to the buttock area or the areas that need a little oomph. And there's a separate, completely different product, Renuva, which is fat from cadavers. And both of them are pricey to very pricey.
Yes. And so, again, if, you know, money is no object, then we can pull a lot of this off the shelf product, and we can do non-surgical BBLs and hip augmentation and contour different areas of the body where we're adding volume. And so we'll have, you know, it's very common for people to come in. I did a consult like this today. Someone's already had surgery before. Maybe she lost a little bit of weight afterwards, like this patient, and she's like, I want some of that plumpness back, but I don't want to necessarily have liposuction and fat transfer again. So you can do as many of these syringes over time as you like. You can do 60, 80, 100 of them over time. It's just the off the shelf price sometimes gets to the point where it actually easily can get to the point where it then becomes certainly more cost effective just to have surgery again. So then patients are sometimes weighing that. But for smoothing, for cellulite, for like localized plumping, it's a great way to not have to return to the OR if we're just kind of tweaking something. Those are the non-surgical BBLs, and like hip augmentation are very popular in Houston and in my practice.
Yeah. I mean, so we talked about the cost right before we started talking to each other and recording it. The cost of Sculptra Renuva, depending on the area, depending on how much you need, we're talking like 60 to 300K. So
Yeah.
that's the actual cost to the patient, because that's how much product you need.
Right. I mean, you think about what we were talking about with faces. Maybe we're taking one syringe and sprinkling it everywhere, maybe two. And then if we're doing 60, 80, 100. So the products were kind of produced to be in line with more like facial volume optimization than it is for body. But there are people that don't have any fat that they can transfer and then are able to sign up for these kind of procedures. And it's a great option for them, because they really wouldn't have any other one.
Yeah. And then another way to sculpt the body, and again, this is like the kid in the candy store. There are non-surgical ways, Emsculpt, to actually have your muscles fire in your buttock, in your abs, and it replicates all of the hard exercise or more exercise that sometimes may be difficult to do. Now, can you imagine having like this device in your living room or maybe in your plastic surgeon office and just getting it done, once a week, once a month, forever?
And you can put it on so many different areas. So, initially people were using it on the abs. So you think about doing like 10,000 crunches or something like that, how much time it would take in 30, you can do that in 30 minutes, and people are putting it on their glutes to shape the buttock, on their like arms, you can do it. So I'm excited to do that too. That's also part of one of my plans, to re-strengthen the core. But it's so funny because you think about those ads that you used to see on TV where people were just like hooked up to some electrodes and then things would start twitching. It's essentially the same concept, but they actually got it to work.
Yes.
And so it's like forcing exercise upon you, and you will be very, very sore afterwards. And they even have a technology that they're using for facial toning. So again, it's not doing anything for the skin, not necessarily building meaningful collagen. But if you tone muscles, that can also at least give you a temporary lift in the face as well.
Yeah. So obviously, like maybe 1 or 2 treatments is quite affordable. However, imagine getting them once every 2 weeks, once every 4 weeks, once every 6 weeks, forever. Then you would definitely look better. But it does, the recovery is obviously very little to nothing. It's really the time and the money involved to show up at your plastic surgeon's office, let's say once a month, to get the treatment.
Yeah. And so that's when you hear of celebrities and performers like ending up with having one of these in their home or something. But of course, that's not typical. The average person can't do that, but they do work if you are able to incorporate them into your routine.
Yeah. So, man, I mean, I'm going to have to spend a lot of money and get this stuff like in my living room. That way I could like watch TV or read books and just go to town.
I'm running a science experiment on myself in the next, starting in a month. So we'll see. I'll report back.
Well, yeah,
see how much I can do in a short period of time.
Yeah, it's always fun to like get all these procedures done and like see the results. So it'll be fun.
And then it'll be fun. And then you can also, it's always interesting for yourself. Like you read we're both so data driven, reading the literature, understand that's really, really important. But there is also so much value into experiencing these things for yourself when you're talking to patients. Yeah. So I am excited about that.
Yeah.
I will have to do what works the best for me follow-up episode.
Well, Dr. Hamilton, it's always good to talk to you for our podcast, The Beauty Scientist. For the listeners out there, please, watch it on Spotify, watch it on YouTube, listen on Apple Podcasts and all other major platforms. And as always, stay beautiful.
Stay beautiful. Thank you all so much for listening.
Thank you for joining us on The Beauty Scientist. Be sure to visit thebeautyscientist.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.